I think the biggest challenge that I faced was with the patients, because you get different attitudes from different patients depending on how they're feeling or what they're going through, maybe with the doctor that they went to, and they're maybe having a bad day. And some people can't make a difference between taking it personally and taking it professionally. I think that's one of the biggest difficulties, going from just doing your work and knowing what you're doing every day and knowing how your day is planned. If you're taking a test, if you're doing lecture, if you're doing an experiment, to not knowing how your day is going to be or what kind of experiences you're going to face that day. I think one of the biggest lessons that I've learned is to empathize with the patients, be understanding, see where they're coming from, put yourself in their feet so you know how they feel. And once you know that, you can go on and beyond on how to make them happy, how to make sure that they're okay and that you have a good patient relationship with them. The work ethic that you need is good communication, good teamwork skills. You want to make sure that you're doing everything correctly, and if you have a question or something, you can bring it up to one of your coworkers, because you're dealing with drugs, medications, and what if you give the wrong one? You're dealing with the patient's life. It's not just, oh, I made a mistake. No, it's a patient's life, and that's something that you need to think about. When it comes to patients, good communication with them also, so that they feel like they're okay. If they have a question, they can talk to you. They don't feel like the doors are closed, because that's very important when it comes to any medical field. Your clothing, I think it depends. The attire depends on your setting. If you're working in a warehouse, if you're working in a closed pharmacy, if you're working in a retail. But I think universally you just want to keep it simple when it comes to your hair and makeup. You don't want to overdo anything, because we're in a professional setting. So that's how you have to do it. When it comes to your shoes, I believe closed-toed, comfortable shoes, because you are going to be on your feet most of your day. When it comes to your clothing, making sure you cover all the parts that need to be covered, making sure you don't show too much, because you're dealing with patients still. They're seeing you as the face of the pharmacy where you're at. You want to make sure that they have confidence in you. Some of the biggest challenges is when you have irate customers, they're upset. You have to make sure that you keep your cool, that you keep it professional, that you don't say anything you're not supposed to say. Sometimes it gets really busy and it gets really hectic, and you're running from one station where maybe you were typing a prescription to now you have to go out and give the prescriptions, making sure that you're quick on your feet. Sometimes you have a long line and it's just never ending. You take care of one person, it seems like two more people come, and you're on your feet, so your feet are hurting, they're in pain. So you got to make sure that you're going to know that you're going to be on your feet. Maybe keep a bottle of water in the break room or close to you, because you're going to be talking a lot. So your throat might get a little bit dry, or just from walking around you might get a little thirsty as well. Those, I think, are some of the biggest challenges that I faced when I went to the working field. Maybe for the first month, it was just boom, this is everything coming towards you. So that's something that you really need to know before you go to working at a pharmacy. You need an upbeat attitude, you need a caring attitude, not a negative attitude at all, because it's not going to get you anywhere. Just in life in general, I believe. You need to know where the patient is coming from, and that's why you need to care about them, because if you care about them, they're going to tell, they're going to notice, and they're going to want to keep coming back to the pharmacy, because their health is in your hands. You're taking care of their medication, some patients on a monthly basis. It's important to have good communication with your coworkers, just to make sure that the workflow is steady, that it's going okay, that there's not a backup in the situation. It's also very important that you have good communication with the pharmacist, just in case you have any questions or there's something that you don't know and you need to explain. When it comes to the patients, it's important to have good communication with them in case they have a question. They need something from you, that they can ask you, that they feel that it's okay to ask you, that the doors are open to questions. That way you could take them, they could talk to the pharmacist, and if they still need your help, you could still talk to them. Maybe they need help with the refill, maybe they need help with their medications, maybe they didn't get all their medications. That's why it's important, making sure that they're happy, and that in order for them to be happy, it takes communication with your coworkers, with the pharmacist, and with the patients as well. When it comes to maintaining education, joining different associations, if those associations maybe have Facebook pages, go into their Facebook pages, making sure that you keep a good relationship with your professor so that if you have a question, you can always go back, that you keep that flow of communication with them open. The most rewarding is having a happy customer, a happy patient when they got their medication. Maybe they had a rough day because they are sick, and when you're sick, you're miserable. And the look that they get when they're happy, they have their medications and they're going home, and you know that you did your job and that because of you, you made their day a little bit brighter. I think that's the most rewarding experience I've had.